Watch me change your mind about what causes mental illness. My name is Dr. Ruth Thoughton. I'm a board certified adult psychiatrist and a metabolic psychiatrist, which means that I look at the overlap between mental health and metabolic health. So when you think to yourself, what causes mental illness? Most people have probably heard of the chemical imbalance theory, which means that disruptions in the amounts of different neurotransmitters, things like dopamine, serotonin, and norepinephrine, lead to mental health symptoms like anxiety, depression, panic attacks, paranoia, and others. And conveniently, we have different psychiatric medications that manipulate these neurotransmitters and, in a lot of cases, can result in symptom improvement. However, we don't actually have any evidence to show that there is a neurotransmitter imbalance in people who have mental health issues. They've done lumbar punctures, which looks at the cerebrospinal fluid and measured to see if there's different amounts of these neurotransmitters. And lo and behold, there is not. But we just know that medications that affect them can affect mental health symptoms. So what does cause mental health symptoms? I'm not going to pretend that I know what causes mental health issues in every individual, but there's a significant piece that we're not taught about and that is not discussed in the mental health field or across the different medical disciplines in general. And that is the fact that metabolic dysfunction acts as a root cause for many different medical conditions, including mental health. What does this mean? So metabolic dysfunction basically means that your body is not able to effectively convert the food or nutrients that you consume into energy that's needed to do all of the different processes that your cells need to do in order to survive and thrive. What happens when there's metabolic dysfunction? Well, it causes things like metabolic syndrome, which you may have heard of. This includes things like high blood pressure, high cholesterol, central adiposity, meaning carrying a lot of weight in your midsection, as well as insulin resistance. So how are these things related to mental health conditions or even other medical conditions? Well, we know that these conditions, in addition to a lot of other conditions related to metabolic dysfunction, all tend to cluster together. So other conditions to consider would be things like fatty liver disease, cardiovascular disease, stroke, PCOS and infertility, migraines, dementia. All of these things are correlated with metabolic dysfunction, and all of those things are also correlated with mental health conditions like anxiety, depression, bipolar disorder. So in this case, where we can see a clear intervention that reversed the insulin resistance and the subsequent results of reversing depression as well, that is pretty good evidence that there is a significant relationship here. And I see that in my patients all the time. If you address their underlying metabolic dysfunction, right, through diet, exercise, and other lifestyle changes, not only do all of their medical problems improve, but their mental health improves drastically as well. But how does metabolic dysfunction actually cause mental health symptoms? Well, we know that things like inflammation, oxidative stress, and insulin resistance all directly affect how your neurons or brain cells are able to metabolize and function in the body. I've talked more about these mechanisms in some other videos, but if you want to hear about it again, let me know in the comments below. Wishing you all good mental health today, and I'll see you in the next one.